Hello. India is actually going through trying times, as are many parts of the world on the COVID situation, and the caseload rising in India, it touching around 4 lakh new cases a day. These are worrying times for India, and this is the second wave, and now there are newer concerns in terms of the third wave also likely to come into India, and what kind of precautions we need to take. What are the learnings that we need to take from what has happened abroad, especially in US and Europe, and what is it that we can be better prepared for an eventuality tomorrow, and what are some of the strengths that we need to leverage further? Where are some of the gaps that we need to bridge? How is the scene unfolding in India? These are some of the questions that are worrying many. So we are happy actually to have Dr. Amita Gupta, Deputy Director at the John Hopkins Center for Clinical Global Health Education, also the Professor of Infectious Disease at the John Hopkins School of Medicine, which is why she's so very important in a subject like COVID. And most important is the India Connect, that she's the co-director of the John Hopkins India Institute, which has been newly launched. Though of course the purpose has been to strengthen collaboration in research, policy, practice, and all the other areas. Though I think increasingly now COVID and issues relating to COVID has also gained a lot of attention there. So thank you so much, Doctor, for your time. We are very happy that you've been able to take time out despite a busy schedule early in the day for you. But thanks so much. Let me first begin by getting your thoughts, Doctor, on your reading of what's happening in India. What's your key concern today?
So thank you, Mr. Sharma. I think the key concerns here is just really what is happening with the tremendous surge, the huge number of infections and fatalities, the overwhelming of the healthcare system infrastructure. We're hearing every day through many parts of India where patients are not able to get a hospital bed or not getting access to essential things like oxygen and treatments. And I think in terms of really thinking about what are the measures that need to be taken to disrupt this huge second surge that's happened. It's a humanitarian crisis of unparalleled proportions. The world is now seeing the most number of single daily cases that's ever been observed in the last 15 months of the COVID pandemic. And it's what we feared for in India, because we knew the 1.4 billion population living in very close quarters, particularly in urban areas. And then, of course, the challenges of rural areas not having necessarily the same access to care. When you have so much transmission so quickly, everything gets overwhelmed very quickly as well. So it's really understanding and how do we address this as quickly as possible so that we can do damage control.
Okay. Doctor, based on your experience with the virus and its waves, both in US and Europe, especially within Europe, countries like UK, for example, what can one expect in India now? And as a corollary to that, actually, what should be the shall we say, the India state of preparedness for that? What would your thoughts be on that?
Yeah, so I think what we've seen now throughout the world is that there are waves of coronavirus. And every time we try to let down our guard, unless we have a large proportion of the population vaccinated, we cannot assume that we can just reopen everything to the way that it has been, just because it knows how to make itself known. Coronavirus pops up in cycles. And we've seen this now in Brazil, we've seen this in the UK, we've seen this in the United States, and in many other areas. But the flip side of it is we're starting to see countries such as Israel, United Arab Emirates, even the United States, where vaccination has quickly been ramped up. And there are places where with high vaccination, they are resuming some sense of normal life. In India, right now, we have just under 3% that have been fully vaccinated. And so that leaves a large number of the population susceptible to subsequent waves of coronavirus. So lessons learned are we have to continue to not be complacent. We have to do COVID appropriate behavior that includes, very importantly, masking, and masking with high quality masks, social distancing. And in this scenario of what's happening right now in India with the number of transmissions, we need to think about targeted lockdowns or even a national lockdown, because that's the only way that we will have to reduce all the mobility and opportunity for the virus to transmit.
Okay, because this is also the month, many mathematical modelings actually have indicated that India is actually in the month when it is likely to touch a peak at a national level, though of course the peak will vary according to different states, and each state will have its own peak. But when you mention in terms of targeted lockdowns and perhaps even a national lockdown, talk us through a bit about why you think that's necessary now, because there is always this debate in terms of the short-term cost versus the long-term cost. Just if you can help us with that.
Absolutely. So, nobody likes lockdowns. I mean, it's obviously incredibly disruptive, but, look at what's happening right now, where we just have so many cases each day, and each day has been, higher than the subsequent day, at least for the past week and a half. And so some areas will stabilize, but in order to really stop what's happening in terms of the transmissions, we have only a few options. Right. So you have, you can sort of you have to do universal masking without a doubt. But in some places where there's so much transmission and so many people who are infected and don't even know that they're infected, this is the problem, right? Is that about half the people are asymptomatic. So they don't even know. And we don't have all the amount of testing to tell them that they're infected. So you have to limit interaction between people when there's so many cases happening and not everybody knows that they're infected. And not everybody's prepared to wear the mask 24/7. So this is where using a public health measure to say you must not leave your house or your apartment or wherever you live, you must stay in place. That is the most effective way to reduce such a number of transmissions. But in addition, universal masking, ramping up testing, and absolutely ramping up vaccination for protecting as many people as quickly as possible and protecting against subsequent surges. So those are the principles, and we've learned them very well over the last 15 months. This is not new or rocket science. This has been shown time and time again as what we have to do. Public health measures that don't require pharmacology and vaccine measures that will allow protection of a larger population.
Yeah, just as a footnote to that, actually, because today, currently as we speak, the rate of vaccination has actually come down compared to what it was at let's say in the early part of April this year.
Yeah.
In India. So at that stage, and the vaccine stocks are also not very high. So if one goes out for a national lockdown or targeted lockdowns without much of vaccination stock available, is it still a viable option, Doctor?
Well, it's like in this scenario, it's a combination mitigation prevention approach. Okay, so it's not like any one thing by itself is sufficient. So you have to have a coordinated plan to do a few different measures. You would be essentially, we recognize that the vaccine access and shortage is an issue, and people are also, we need to increase the vaccine access, and there's a lot of effort right now going on that front. We also need people to realize that minimizing contact by wearing masks as well as staying home. And unless you really need to leave your home, you should be working from home. You should be, staying at home so that we can interrupt. The number of transmissions are so huge, right? Think about what happened last year. And of course, everyone's scared to have a national lockdown because it really was devastating economically. And, many, many people lost their livelihood. So I think the idea here would be to look at high incidence areas, and they're already doing targeted lockdowns in Delhi and parts of Maharashtra and other areas which have seen a huge surge, and it is having an impact. It's starting to slowly bend the curve. So, I think that we may need a period of time, just like the UK did, where we had a national lockdown to just help reduce the burden of infections and give the healthcare infrastructure some time to recover what it's seeing right now. Yeah.
Doctor, related to that actually is, as what we discussed a while ago, is that now India is actually expected to have a peak this month. So while each state will have its own peak at a different stage, going by the experience in, let's say, US, for example, which again, different states had its own, they took their own time to get to their peaks. How long, what is it that you think we have learned about how long it takes for the virus to die down in a community? Some sense on that will help.
Yeah, so I mean, I think that, once we start to see the peak of infections and you make some public health measures, usually, it takes within 4 to 6 weeks for it sort of to start to come down on a level where, and again, it all depends on the combination of COVID appropriate behavior along with reducing mobility, right? I mean, I think that the combination has to occur, especially when we don't have a way of further ramping up in the very short term vaccination. So you essentially, most of the models take into account that after you impose some of these measures, usually 4 to 6 weeks is sort of the time where you start to then bend the curve. That's the typical amount. And then of course, we always have a delay between the infection and when people are, peaking in terms of number of hospitalizations, because that time frame is about two weeks or so, 2 to 3 weeks after we start to see the peak coming down. People will be hospitalized because, it takes a couple of weeks for the infection to get to its most severe state if you've been infected. So, deaths and hospitalizations always lag the initial sort of number of people testing positive.
Okay. So because if you understand, if they're saying that in month of May, say by end of May, if you're touching a peak, then take another 4 to 6 weeks. So by end of June or early July is when actually we should be at a national level seeing lower cases. And if that happens, and whenever we talk to the vaccine companies, most of them are actually ramping up the productions from July actually. For Serum Institute, for example, is intending to produce about 100 million from July. Sputnik vaccine is also, I think, more stocks are expected from July. Bharat Biotech also from July. Cadila Healthcare is also expected from July. So I think by end of June, early July, we start seeing lowering of cases and more vaccines coming into, perhaps that may be where we are probably headed.
Yeah. And I think in the meantime, having strict universal mask wearing, avoiding large gatherings. We know if you're outdoors with the mask, much less risk than if you're indoors without a mask, right? There's some simple principles people can follow while we wait for vaccination to be ramped up. And that has to continue until we have really a large proportion of the Indian population vaccinated, because there will be waves of this infection
There will be waves, you say, and very important, because that wave is actually something which, when you mention the word wave now, it gets people very conscious and dangerously concerned. There's talk of a third wave also likely. What is your thought on this third wave and the way it's likely to be impacting children and possibly around September or so? What's your view? What is the lessons globally tell us about expectation for a third wave?
In the United States, we have had 3 waves already. We had our wave in the spring, and we had our wave in the fall, and then we had a huge wave, even larger wave. Our third wave was the largest. I think, again, we know this disease from what we've seen in much of the world. It goes in waves, and it will continue to go in waves until we have, the population largely immunized. And that's what we want. That's the goal. Trying to do herd immunity through natural infection results in unnecessary huge number of people dying. And that's not the solution, right? That's the last thing we want. So until we have vaccination for the majority of the population, we have to do COVID appropriate behavior. Masking is very effective if you do it correctly and wear well and avoid large gatherings.
Yes. Doctor, so masking very important, vaccination is very important, but to be better prepared for the third wave, other than these two, from the health infrastructure point of view, the rickety infrastructure that sometimes people complain of in India, is there anything from that perspective that we need to be focusing on right now so that we are better prepared by September?
Absolutely. So we need active surveillance. So that's a concept where you're testing routinely populations, irrespective of whether they have symptoms or not. So you can tell if there's an increase in the number of people becoming infected. And that's what we do in this country. States by states, we sort of are routinely testing and seeing what proportion of asymptomatic people and what proportion of symptomatic are testing positive. So that's, you have to do surveillance. You have to, we want to also have good coordination of information so that this can be in real time. India is an IT powerhouse, has the best, engineers and mathematicians and IT software. And so using the power of data to help in real time inform where are the trends, where are the hotspots, where's the uptick in infections. So you need that to be good testing, good information, rapidly actionable information. So that is going to prepare for any subsequent wave. And as soon as you start to see a rise, you say, look, there's a rise, you make that known. Please everyone be very careful, wear your mask, do not have your, planned wedding, don't have your planned big cricket match. You have to sort of be careful and stay at home because there's a rise in the infections in your neighborhood. Those people can sort of see and respond to appropriately.
Yeah, what I meant actually also was this concern that perhaps, do you think from an infrastructure point of view, we should be reaching a stage that at a short notice, let's say primary healthcare centers in remote parts of the country is at short notice able to rapidly immunize a lot of people?
Oh, absolutely, absolutely. And so, it's interesting. I'll give an example. In California, in San Francisco, the health department there sort of mapped out all where in the first and second wave the infections had happened, and based on that information, used that for its vaccine campaign and really heavily prioritized vaccination in the areas that had the highest surges. And so using that kind of information to prioritize target resource allocation, vaccination, messaging around COVID appropriate behaviors can also be effective, right? Because it's heterogeneous in parts of India. And we know that the waves have typically started in the West and South and in Delhi and then sort of spread to other areas. So you can use that information to help you decide where to spend most of your time and energy, at least initially,
Yes.
where you're having your most infections occurring.
Okay. One more thing, doctor, is this some thoughts that you can share on what have we learned about this, shall we say, the much abused notion of herd immunity? Is it still relevant, doctor?
Well, we know, it's a concept that exists in infectious diseases and public health. It's just that with this particular disease, herd immunity will have a huge price. So what does herd immunity mean? It means that the infection has infected a large proportion, usually around 80% of the population. And then the remaining 20% that's not had the infection is essentially immune because you've kind of managed to make that infection run its rounds to the vast majority. Here, what we don't want is herd immunity. We want immunity, and we want immunity from vaccination, not from natural infection, because natural infection with this disease causes death and devastation and overwhelms the healthcare system. So trying to reach the goal of natural herd immunity is not what we're intending to do. We want immunity, but from vaccination, from preventive behaviors. So
that should be the in focus right now. And doctor, the important connect which I wanted to come to, and perhaps you could spend the rest of the time just kind of explaining us on that, is if you could explain to us about this whole concept of John Hopkins India Institute. What is the ground that it intends to cover? The reason for setting it up, and how actually the COVID has become so important to you. I understand that you also set up a task force. Tell us a bit about what you intend to do with this.
Yeah, so, as a university, we're an academic university, and we've been actually working with India for the last 90 years. And we have had a training mission where in public health and medicine and in other areas for many, many decades. And we have many, many fruitful partnerships. And so the point of the Institute was to bring together the over 100 faculty that are working in India with over 100 Indian partners to come together, strengthen our relationships, and foster new productive ones. Because I think by working with India in a very close way, we can answer some of the many biggest global challenges. India has so much to offer in solutions. It also obviously has many burdensome diseases. And if we can solve problems in India by working closely and collaboratively with our Indian partners, we can find solutions for the world. And that's really the goal. And we stretch from research, policy, and practice and education. At all 4 domains across the university, uniting to be sum greater than the parts. That's really the goal of what we're trying to do. And we already have some phenomenal relationships and outputs, but we're looking to strengthen them further by thinking much more at scale and bringing solutions that we find together for the rest of the world.
Tell us a bit about the COVID task force. What does it want to do? I mean, there's a lot of interest about what you intend to do short term and long term.
So we did indeed, as a result of this second surge, rapidly mobilize to form the Johns Hopkins India Institute COVID India Task Force. And what the goal of that task force is to improve awareness and coordinate activities around advocacy, technical collaborations, humanitarian assistance, and to identify opportunities that really address the COVID-19 pandemic in India, not, largely for our university, but also for our partners working in India. So we are providing support when invited to do so by our partners in India, whether it be around some of the hospital needs, planning, writing pieces to help the Biden administration, for example, know what are some of the actions they can take on behalf of the US government, thinking about planning, modeling. We're helping some of the modeling efforts so that we can see what impact vaccination rollout will have for the subsequent waves in the country. And we're also connecting. So, corporations in the United States, there are many NRIs, non-resident Indians, and leaders, and we're helping them to sort of see how they can be effective in their response and mobilizing their base. So we're, as well as connecting our own community to knowing which organizations to support through their financial contributions. So we have, as I said, a range of advocacy, policy, practice, and immediate mobilization when our partners are asking for assistance, and we can provide that. We try our best to do so.
Okay.
So that's really our efforts.
That's quite a lot. But if you were to say what is engaging your attention at the moment, if there's one particular thing that in this whole gambit of things that you're looking at, what would that be currently in India?
Yeah, sure. So I think there are really 2 areas. We work closely with partners who are on the ground, including hospitals, clinics, and NGOs, as well as government. And so we're being directly responsive to their needs to the extent that we can, both financially and with technical assistance. Those are the areas that we're focused on, responding to what our partners are telling us on the ground.
Okay. And what are they telling you? I'll end with that.
Well, they're telling us that they need help with coordination and supply chain around essential supplies, things like oxygen, medications, as well as testing kits, and then helping them to plan and get more attention to the need for vaccines. So part of what's happening with access to not only the COVAX and Covishield, but also the vaccines that are made in the rest of the world need to be provided to supplement the shortage that's currently happening in India.
And you're trying to facilitate that?
Yeah, by communicating and by raising awareness and by talking and having dialogue.
Okay, that's so very nice. So thank you so much for your time. It's been incredibly nice listening to you and to gather your experience from what's happening in the, shall we say, the rich nations to what perhaps we can imbibe now as we get into tougher times, actually. So thanks so much for your time, Doctor.
Thank you very much for the opportunity. And please be safe and take care.
Same with you, Doctor. Thank you. Please take care. Bye-bye.